A very common request that comes up is alarplasty or nostril reduction surgery. I do this very frequently, I would say probably about 75% of the time along with my rhinoplasties, but sometimes patients like their nose and all they want is a simple reduction. The way that we do it is we remove a little bit of extra skin from around the edges of the nose. Now there are a few different techniques. I prefer to remove it right here about a millimeter above the natural crease because you don't want to blunt the crease, and removing a part of the nostril here. The incisions heal really well and they create a very nice fine continuation. The key is reconstructing the nostril to the base over here called the nasal sill. And there are a few tricks to doing this the correct way, but essentially it's taking all the tension off, making your markings in the right spots, and making your cuts in the right spots. The other thing I really like to do, now normally when I'm doing my rhinoplasties, I'll strengthen the nostrils as it is. However, since we're only going into these areas over here, we're not really working up in this area here. What I mean by strengthening nostrils is when we make these cuts, we bring the nostrils in. If we bring them in, one thing I've noticed is sometimes this tends to tent up and round out a little bit. During rhinoplasty, I put little grafts of cartilage in here. So what I'll typically do with my alarplasties or nostril reductions is through the little incision on the side over here, I'll take a little cartilage from inside the nose and we put it in the reverse fashion. Thus, we're strengthening this part so it doesn't just round out, because if you bring that nostril in too much, again, it tends to get that round and almost weaker type of rim over here. By putting the little graft up in here, through here, it doesn't really take much more time, but it's really worth it. It creates a really nice, aesthetically pleasing nostril. So there are several very important nuances to this, but it is a relatively simpler procedure if you know the right things to do and all the right details.